So I was 30 at the time. I noticed a few changes throughout pregnancy. I then mentioned to my midwife at the time that I'd noticed some changes. She asked me to then go and see my GP. And she also sort of, tried to reassure me on that side. And again, we put it down to changes in hormones, everything around that side. But the lumps continued to grow throughout my pregnancy as well. The pregnancy second time round was very different to my first one. So again, I kind of just put it down to this is just a different pregnancy. And then off the back of seeing the GP, I was then referred for an ultrasound for checking everything over. They then found that it was the case that they needed to refer me for biopsies and a further ultrasound. And then I found out that I had bilateral breast cancer as well. So it was around, I think it was 31 weeks pregnant at that point, so third trimester. After that, after I got my diagnosis, everything moved very quickly, and there was a whole plan for everything in terms of my treatment, delivering my son, and all the care that would follow afterwards as well.
I can't even begin to imagine where your headspace went to, and pregnant and already having a child to look after at home.
Yeah.
I found a lot to deal with, and it was just me. I can't even begin to imagine.
Yeah, it was really hard. I think the main issue the struggle that I had was thinking, well, am I going to come through this as well as my son? And then will I then be around to see both of them grow up, everything on that side? So it was difficult to kind of balance the point of, maintaining a normal life for my 2-year-old at the time. Yeah. He needed to know nothing about it and just continue and be there as normal, but then get through everything that was needed. I said at the time, I just wanted to treat this as a kind of, this is what it is, move on, and just carry on as much as possible. When they gave me my diagnosis, they said it was treatable and it would be okay from there. So I just had to kind of cling on to that at that point and just go with it.
Yeah, gosh. Anna, do you feel you were given enough support and information at the time?
I think, yes. Once I'd had my diagnosis, I then moved to a different care team, and everybody was fantastic that I dealt with. I was allocated a breast nurse as well, and she was wonderful. She supported me through everything, every question that I had. I then had Naren as well as my surgeon, so he was fantastic in terms of answering all the questions that I needed to go through. The oncologist that I had was wonderful. So, yeah, the support I had was fantastic. And then in terms of delivering my son as well, everything was arranged and fully explained to me. I was given more of a say into everything as well as to how things went. In
terms of what way?
It was very much sort of looking at, at what point they gave me a range of when he needed to be delivered. And then I was given the option of steroids to kind of help his lungs develop because he was going to be born prematurely. And looking at that side, and they gave me a rough window of dates. But
yeah. And I guess in terms of things, at least that was a little bit of control compared to so much control taken away from you.
Very loosely.
Yeah.
Everything was just kind of, I trusted everybody that was looking after me. I went with what they said, and I just wanted to get through it, come out the other side, and then sort of continue my fight the other side once I'd got my son.
And I have to say, you're looking incredible. Absolutely amazing. Now, Ellen, how often do you see these cases?
So breast cancer within pregnancy is in about 1 in 3,000 pregnancies. Because of where I work, I will perhaps see it more often than most people just because I work in a centre, and I am one of the people that sort of advise from a regional perspective. So we work with other hospitals as well. So I would see it much more commonly, but obviously it is very rare. And I think, Anna, with what you said about those early stages of not realising understandably yourself that it could be something, but worrying what it might be, and other people thinking, well, goodness, you're young and you're pregnant, it's unlikely to be, and it is unlikely to be, but it's something that we really need people to be aware of as medical professionals and women, not to be worried, but to absolutely, as you did, get checked and to make sure the right tests are done and the right people are involved.
I think that's a really important point, because when we have to look after women with this so-called pregnancy-associated breast cancer, it really has to be a specialised team.
Yeah.
And it's quite a large team, which includes the breast care nurse, the surgical team, the obstetrics team, the oncologist, but keeping the individual at the centre. And the care needs to be mindful that there's 2 individuals that we're treating, not just the individual diagnosed with the breast cancer, who will clearly, from a breast cancer perspective, be the primary individual, but there's also that individual, that is yet to come to life, I guess. So in terms of pregnancy-associated breast cancer, it's worth understanding that there is a definition, and that tends to be breast cancer that a lady gets whilst she's pregnant, but also in the year after pregnancy. And when someone develops a breast cancer whilst they're pregnant, it tends to have similar characteristics to breast cancer that we see. When we see breast cancer in the year after having the delivery, it can be a different type of biology because the breast is going back to its normal function. So it's a process we call involution. And as part of it, the breast is changing back to its normal function. So the environment for that breast cancer to develop is very different. So it's worth understanding that. In terms of Anna's story, there is an additional part to it, and that involves a gene aspect. Would you be comfortable taking us through that?
Yeah, of course. So after I had my son, I then started chemotherapy 10 days after he was delivered, of which I had 6 cycles. I then had a double mastectomy at the end of that, and the temporary expanders put in whilst I kind of decided on my reconstructive journey, I guess. I then had radiotherapy as well. And then there was a lot of discussion around sort of why it happened to me, why at the age of 30 it had come about. I didn't have a history in my family of breast cancer. And so then we looked at whether the genetic testing needed to be done, which it was. And they found out that I had the BRCA2 gene as well. That then changed a bit more surgery that was needed. We had the discussion about whether we'd completed our family, at which point we had. And so then I decided to then have my ovaries removed as well. When I had the reconstructive surgery, just because it was that extra level of protection. I thought, I've come through this at this point. I've fought everything I need to do. I need to make sure that I then continue that and kind of make sure that I have as much of a reduced risk of this recurring as possible. So I decided to then have my ovaries removed as well. But that was off the back of discovering that I had the BRCA2 gene as well.
I imagine that you can't, one can't understand that you are carrying your son, happiest part of your life, I guess, and then you still have to manage this. And I imagine it's a sort of bittersweet type set of emotions. Is that?
Yeah, very much. It was difficult a difficult situation anyway. I don't know who I blamed. I blamed somebody, something, in terms of feeling like I'd had this experience robbed from me. I didn't get the chance to kind of be in that lovely kind of postnatal bubble of everything that you generally do when you're on maternity leave. I felt like I was just sort of existing in that time to get through, and then I could come through the other side and enjoy it. So it was difficult to feel like I could immerse myself in everything because I was having to kind of have each round of chemo, get over that each time, but then also try and maintain this normal life for my 3-year-old at that point as well, and a newborn baby. And I felt like I didn't necessarily have that bond with my youngest for a little while because I couldn't be there very much. It was a case of physically not being there and sometimes mentally not being there. But I do have now, and I'm incredibly tight as soon as I came through, and I kind of count him as my miracle baby a little bit. I'm really sorry.
No. And you know what, actually, like you said earlier, breast nurses are amazing. And what the best piece of advice I had when I was diagnosed with the breast nurse was telling me to let out all my emotions and not to hold them all in. And I always say, like, you think of like your children, like when they fall over, they get up, they'll have a cry and then they move on.
Yeah.
And we as adults, I think we always try and hold them in and be brave. And do you know what I mean? Like, you're already remarkably brave and inspiring and amazing. And yeah, don't be scared to ever release.
So in terms of, as a male, clearly these sorts of environments, waterproof makeup is a good one. So whenever I'm in the breast clinic and have to give a bad bit of information, you can tell if someone has pre-thought it. So apologies. I'm so sorry you're having to relive this again for you. Ellen, in terms of, have you come across cases where women have wanted to delay treatment because they're worried about the impact it will have on the baby?